Ashley. I'll be your nurse today. Can you confirm your name and your date of birth for me?
Brianna 1/6/2496.
Okay. And I'll make it over here to the MAR to make sure that I have the right patient and the date of birth is correct. So now I'm going to ask the patient what brought them in today.
Head to toe assessment.
Okay, and the MAR tells me that, so we have the right patient in the right order. So now I'm going to close this for safety. Now I'm going to wash my hands. I'm going to explain to the patient that head to toe assessment. So we're going to start from your head and go to your toes. And if you ever feel any discomfort, just let me know and we'll stop. So I'm going to start by palpating the head. There's no masses, no lumps, and the hair is full and thick. So now I'm going to make sure that the eyebrows and eyelashes are also full and thick and symmetric bilaterally. So now I'm going to get you to look up, and the sclera is white and the conjunctiva is moist and pink. So now look over here for me, please. All right, and I'm going to, all right, now follow my finger. Alright, now I'll be able to say that the pupils are equal, round, reactive to light, and accommodate. And next I'm going to come and palpate the lymph nodes. And if they're tender or there's anything abnormal, just let me know if anything hurts. Okay, the lymph nodes are good. Next we're going to look at the ears. Alright, nothing abnormal in the ears. Feel the ears. No masses or lumps in the ears. Let me know if you hear this. Do you hear this? Okay, now I'm going to get you to lay back for me. We're going to check the jugular vein. Alright, there's no distension in the jugular vein. Okay, next I'm going to get you to look at me and make the same faces I make. So puff out your cheeks, stick your tongue out. Move it to the side. Open your mouth. Okay, the face is symmetric bilaterally. Alright, now I'm going to check the nose for patency. So go ahead and breathe out that side. Alright, breathe out that side. Alright, the nose is patent. Now I'm going to assess the temporal arteries. And they're equal bilaterally. And then I'm going to check the carotid pulse one at a time. And then I'm going to listen to the carotid with the bill of the stethoscope. I'm going to get the patient to not breathe or hold their breath for a second. Right, there's no bruise over the carotid artery. Alright, now I'm going to get you to open your mouth for me. Alright, the mouth is moist and pink. And I'm going to say ah. The uvula and the soft palate rise. The patient also has good mouth hygiene. So now I'm going to assess your breathing. So just breathe normally. Go ahead and turn around for me, and I'm going to do the same thing. On the front side, there is no adventitious sounds, no wheezing heard. So now I'm going to check the back side. There's also no abnormal sounds heard, and the rib cage is at a 45-degree angle, and the intervertebral spaces are at a 90-degree angle, and the AP ratio is 1:2. So now I'm just going to palpate and let me know if you feel any tenderness. Alright. So normal findings, and now I'm going to assess. So breathe in, and rib cage inflated quickly. So now I'm going to get you to lift your arms. And I'm going to assess the sounds on the sides. Alright, I heard no adventitious sounds in my patient. So I'm going to go ahead and move on to assessing their heart. So you can go ahead and turn around. Alright. I'm going to go ahead and start by getting the patient's apical pulse for a full minute. The patient's apical pulse is at 85, which is normal, and their respiratory rate was also normal, and that is either between 12 to 20 for a normal patient. So now I'm going to listen to the heart sounds with the bell of the stethoscope. I'm going to go back to the diaphragm and listen to them. Okay, there's no abnormal sounds, there's no thrills heard with the bell, and there is no murmurs heard with the diaphragm. And now I'm going to go ahead and check your temperature. So just lay your hands flat. I'm just going to make sure your temperature is good. The skin is okay, you gotta lay down. I'm going to lift the shirt, and I'm going to ask the patient. I'm going to ask the patient if she's had any tenderness or anything I need to know about before I start palpating her. So do you have any tenderness or anything? Okay. So I'm going to go ahead and listen in all 4 quadrants. I'm going to start in the right lower quadrant. Okay, vowel sounds are heard in all 4 quadrants. And if there was not vowel sounds, then I would wait 5 minutes and call the doctor. So now I'm going to listen for vascular sounds with the bell. Okay, there's no vascular sounds heard, which is good. So now I'm just going to palpate and just tell me if there's any tenderness. Okay, now I'm going to go ahead while the patient's laying and check for the Hohmann's sign. So let me know if you have any pain. Okay. You can go ahead and sit back up. Okay, go ahead and put your arms out for me. And I'm going to check the radial pulses. And they're equal bilaterally. And then I'm going to check the popliteal pulses. And they're also equal bilaterally. And I'm going to check the posterior tibial pulses. And they're equal bilaterally. So while I'm down here, I'm going to go ahead and do the dull sensation and the sharp sensation. So let me know what you feel.
Sharp. Dull.
has full peripheral senses, and there's no edema. The skin is not excessively moist or excessively dry. And I'm going to go ahead and check for capillary refill. So capillary refill on the fingers was less than 2 seconds. And it was also less than 2 seconds in the toes. So I'm going to look at the fingers one more time. There's no signs of trauma, and the fingernails are 160 degrees. And I'm going to go ahead and get you to stand up. Okay, I'm going to get you to put your arms out, up. Get you to roll them. Okay, and then I'm going to get you to put your head this way, down, back. Okay, now walk over here. And then walk with your hand, with heel to toe. Okay, now you can stop right there. Close your eyes with your hands by your side. Okay? Patient has a negative Romberg's test. My patient was alert the whole time, had a level of consciousness where she knew where she was, who she was with, why she was here. She spoke clearly. Her gait was without stagger, and she was never confused and heard everything I was saying and was able to interpret it. So I assessed my patient with no problems, and that's the end of my head to toe.